Good afternoon. My name is Tom Stelfox. As Scientific Director of the OBrien Institute for Public Health, there is nowhere else I'd rather be having my lunch than with all of you as part of today's panel discussion, Anatomy of a Pandemic, Health versus the Economy. How do we leave COVID-19 behind? This event is jointly brought to you by the OBrien Institute and the Haskayne School of Business. The OBrien Institute is a research institute at the University of Calgary with over 1,000 members and affiliates from faculties across the university. We function at the interface of the university and society. Our mission is to advance public health through research excellence. For us, this means creating and promoting evidence-informed strategies to support population health and effective healthcare system to catch us when we are in need of help. I'd like to thank Liz Lay, Pablo Fernandez, Brittany DeAngelis, and members of our communication team for organizing today's panel discussion, and Jim DeWald, Dean of the Haskayne School of Business, for partnering with us to bring members of the public health and business communities together in conversation. It's been over a year since the WHO declared COVID-19 to be a pandemic, and it continues to have a major impact on our world. As an intensive care physician, I've had a front seat to the interlinked physical, mental, and financial impact of the pandemic on my patients. Let me share two brief stories that stand out for me. I remember a year ago, a middle-aged woman admitted to the ICU with severe COVID-19 pneumonia. We gave her the best treatments, but she kept getting sicker. We finally decided that she needed to be put on life support. As we were getting ready to do this, she asked us to call her employer. It struck me that her last words were, "Let my boss know that I can't work this week. I'll be back as soon as I can." More recently, I cared for a man who was brought to hospital profoundly ill with diabetes that had spun out of control. After providing him with successful treatments, we learned that the trigger for his failing health was the loss of his job in an industry that had been shut down for most of the past year. This resulted in him not only losing income to buy good quality food and medications to manage his diabetes, but also resulted in loss of his entire social network, life routine, and sense of purpose. The pandemic has had a devastating impact on the well-being of many individuals like the two I've described. As we emerge from the third wave of the pandemic, vaccination programs continue in urgency, and provinces around the country relax public health measures, there's an opportunity for us to think about how we collectively go forward to advance our physical, mental, and economic well-being. Today, we bring you an expert panel to discuss these hopes and challenges. To lead us in today's discussion, we're fortunate to have Dr. Fiona Clement, head of the Department of Community Health Sciences at the University of Calgary, with which the OBrien Institute has a close and deep partnership. She is director of the Health Technology Assessment Unit in the Cummings School of Medicine. Her influence on health policy was most recently recognized when she was named one of the most powerful women in Canada in 2020. Dr. Clement, thank you for leading us in today's discussion.
Thank you, Tom, for those kind words and your welcoming remarks. I would like to take this opportunity to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, the Kainai, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta, Region 3. I would also like to request that we pause for a moment of reflection as we come here together today at a place of learning, a place where people send their children to learn, knowing that Indigenous children are buried at supposed places of learning, a place that would usually be associated with playgrounds, laughter, joy. The gravity of the now over 500 bodies that have been found, with the knowledge that many more remain in their unmarked graves, requires pause. Please join me in a 1-minute reflection. I'll do the timing on my end. Thank you. We are in for a great hour today. It is my pleasure to introduce our 4 amazing speakers to you today: Dr. Jones, Mrs. Robinson, Dr. Toomb, and Mayor Nenshi. You will hear from each of them first, and then we'll open the floor to what I know will be a lively conversation. Their impressive bios have been pre-circulated, so I won't be restating all of their accomplishments as I introduce them, but instead I'll share what I've learned about them while Google stalking them. Before we begin, I want to encourage everyone to continue the conversation online. So spread the word using the hashtags, which Liz will put into the chat box and should be coming up on the screen. And of course, feel free to enter your questions into the Q&A chat box, which should be at the bottom of your Zoom window at any time throughout the event. We'll do our best to answer as many questions as we can during the time that we have. So first, it is my pleasure to introduce Dr. Jones. Dr. Jones is currently the Dean at St. John's College in Winnipeg and a professor in history, community health sciences, and the humanities at the University of Manitoba. Her expertise is on the influenza of 1819 and its lasting impact on society. Her talks, op-eds, and podcasts in 2020 alone take up 10 pages of a Google search, which should give you a sense of how her voice has been informing our thinking throughout this latest pandemic with COVID. Thank you so much for joining us, Dr. Jones, and over to you.
Thank you very much. I'm just going to quickly share. I just have one little slide to share. So I'm just going to share that, and I'll talk about it in a second when I get to that point. Thank you so much for the invitation and for that very generous introduction, Fiona. I'm going to remember that for my activity report. Your Google stalking will stand me in good stead. So we've been asked to speak about the relationship between health and the economy as we go forward out of COVID. And, I want to begin just by saying that health and economy are not oppositional ideas, but rather are interconnected in 2 important ways. The economic system, especially wealth inequality and the persistence of poverty shaped by colonialism and gender and racial inequity, plays a key role in determining both the overall health of a society, say, for example, lifespans, or in the case of this pandemic, vulnerability to infection and to death, and determines the health of the individual. But there's also another important side to that relationship, and that is that poor health also impacts the economy. And a good example from global health is how the prevalence of infectious diseases like tuberculosis or HIV/AIDS cause significant disability, loss of income, and overall lower economic productivity. I mean, there are currently 1.4 million people a year globally dying from tuberculosis, and TB deaths result after years of disability. So I want to talk just very briefly about each of those 2 points. We do have abundant historical evidence about the relationship between inequality, disease, and public health. Beginning around the 1830s, the growth of capitalism and imperialism coincided in the West with extensive infectious disease outbreaks. The 19th and early 20th centuries did lead to some effective public health policies, especially those based in a dual approach of containment measures, quarantines, for example, and in rare cases in that period, vaccination, as well as amelioration of the worst impacts of inequality, improvements to sanitation, housing, greater workers' rights, rising incomes, and so on. So the image is from a task force that I was a part of at the Royal Society of Canada. And this dual approach is really the approach based in public health history that we talk about in this paper, and you can read it on their website if you'd like to see it. I want to emphasize that the dual approach means that neither those 2 approaches, containment or addressing things like housing, can work on their own. They only work in concert with one another. At the same time, poor health and the negative economic impact that poor health brings demands greater access for those who are not well served by the way we currently organize our healthcare services. Historically, advocates of socialized medicine in the 30s and 40s emphasized the need to integrate preventive and curative care and to provide it closer to home, rooted in community where relationships could be built on a fundamental right to equal access to care. Health insurance, even public health insurance under Medicare, has never achieved this model. So I think we have an opportunity after this pandemic to build a more accessible system, and one that draws together prevention and primary care, because in my opinion, we are going to need both of these pieces. Thank you.
Thank you, Dr. Jones. Next, I'd like to introduce Mrs. Robinson. We're very pleased to have Tracy Robinson in our conversation today. Ms. Robinson is an inspiring leader with a wealth of business expertise, and I'll note specifically her mentorship and leadership of women to the C-suite, which has changed industry, both the energy industry and more broadly. She's the Executive Vice President and President of Canadian Natural Gas Pipelines at TC Energy and President of Coastal GasLink. She's accountable for the growth, operation, and profitability of the company's federally and provincially regulated natural gas pipelines. And she has long fostered a sense of innovation, collaboration, and community giving. Most recently, she's channeled these passions to helping shape the TC Energy's Indigenous Reconciliation Action Plan and sustainability strategies. Thank you for joining us today. Over to you.
Thanks, Fiona, so much. And let me tell you what a pleasure it is to be joining you today for what I think is the beginning of some very important conversations. It's my role here, and it's my pleasure to give you a bit of perspective on how COVID, how this has all gone over the last year for business, and I'll speak through the lens of ours, although you know, there's many unique experiences from a business perspective. I think there's some real themes. At TC Energy, we deliver the energy that people need every day. So we provide about 25% of the natural gas that North America uses every day, and we provide the power to power more than 4 million homes. We have operations across Canada, the United States, and Mexico. And you know, I share this because when the pandemic started, you know, we were deemed, as many are, especially in healthcare, an essential service in all of our operating jurisdictions across North America. So we had the unique situation where we declared our crisis plan on one Friday afternoon in March last year, across our entire network, all at the same time. That had never happened before. You know, so we had to, you know, across our business and as many businesses did, in fact, all businesses did, had to rise to this challenge. And it, I would say, tested our stamina and our ingenuity. Now, our employees, of course, have a tremendous amount of pride in what they do, and it kind of drove the success of what we've been able to do over the last year. You know, they know that we provide the power that runs the technologies for millions of people. You know, when we all sent them home to their makeshift home offices every day, it's provided the heat that kept homes and hospitals warm, transported the fuel that allowed kind of all of the deliveries of important goods like vaccines and other things to take place. And whether you were physically working out in the field operating our infrastructure, or if you were on a construction site or working in a home office, it was, and it continues to be, that creativity. It's the people, the creativity, the resilience, and that unshakable dedication of, you know, what is for us 8,500 employees and contractors that has kept us going. And so I know that what we're here to talk about today is how we successfully emerge, but I think it's important context as we do that to reflect on how we all responded. So this has been and continues to be, I think, a crisis of considerable scale. And I'll give you a little perspective on our business, you know, through the lens of Alberta and British Columbia. Last March, we had continued to have thousands of people in the field every day, operations folks, ensuring that our pipelines and our facilities continue to work. We were at the time peak construction, Alberta and British Columbia. We had about 4,000 employees and contractors situated across Alberta and northern British Columbia, staying and living in 16 workforce accommodation sites, camps. They work and live in very close quarters. We had office folks in the case of Western Canada, in Calgary and Vancouver. So our challenges as this all happened, we needed to keep operations and construction proceeding. What that means is that we need to keep our workforce safe in the field. They needed to get up every day and go out to the field, and we needed them to be confident that they would be safe. It's the only way you work effectively is if you believe you'll be safe. It's critical that we kept the many communities, including the Indigenous communities, safe. My apologies. It is, and whether you are, so we did this by, there's immediate protocols that we all had, but, we need to also, across those 8,500 people and across all of our communities, have a strong engagement to build that confidence that it's okay to go out there when there's so little we know about what's going on around us each and every day. So for us, that meant, given the number of people we had in the field, putting in plans in the event that we had any kind of an outbreak. That meant for us emergency services, medical services and personnel that were situated at various places across Alberta and British Columbia that would be mobilized on an instant for purposes of testing, of isolation, of treatment, and of transportation. We have a global supply chain. We rely on local and international suppliers for materials and services. And it took an incredible amount of ingenuity to ensure that nothing stopped, but also that we did the right things to keep those businesses and those companies healthy. It's important that they're still there when we come out of all this. And we did recognize early on, as we figured out how to keep working, the challenges that some of the smaller businesses and the communities were facing and the role that we could play in supporting them. So we continue to call upon local hiring and talent. We supported the local community hotels by having our crews, wherever possible, staying in there. We called upon those hotels and local restaurants for food services. And we set up a corporate giving program for communities and for Indigenous communities so that employees directly, as well as our company, could help. So this has been kind of the focus that we've used over the last year. Safety is our primary goal, and it's a core value for us. And we have what we call zero is real from a safety perspective. We tolerate nothing but zero. And so at COVID, we committed to and succeeded in kind of zero COVID related spread as we continued on our operations and construction over the last year. So we were, we're also able to successfully operate, no exceptions. We met all of our construction commitments with the exception of a 3-month period earlier this year where we worked with Northern Health and a number of other large projects in Northern British Columbia to reduce the workforce for a period of time to allow hospital capacity to kind of catch up. And we did arrange, as did the other large industrials in Northern BC, something I think we should continue to look at. We're still doing this. We did arrange that in partnership with Northern Health, we would provide vaccines to the workers that come to work on our facilities each day in Northern British Columbia. So that process is still continuing. It's on a voluntary basis. It's in partnership with Northern Health in British Columbia, and it's administered by our health contractor, which is International SOS. So our ability to participate in that and others to participate in that meant we were able to help in Northern British Columbia to make sure that we got ahead of the vaccine and got ahead of COVID with the vaccines, and that we were able to keep those communities safe as well. That kind of partnership, that's new to us. We haven't done that before, but I think it is critical to keeping everybody healthy and safe, while it also keeps our businesses and the economy kind of chugging along. Now we know that the human cost of this virus has been staggering. With the vaccines rolling out in the way that they are, we're optimistic. This seems better and better news every day, and we hope that we're on the road to recovery. The costs, of course, are not just in physical health. What we're all discovering is the toll that this has taken on our mental health is significant. In some ways, it may be even more challenging because it's more difficult to see. It's less likely to be acknowledged, but it's critical to the health of our communities and our companies and our ability to lift out of this. I think we've yet to see and fully understand the impact of this. I know in companies and businesses, we're trying to get a sense of how we help and how we insert ourselves before you get to that point of crisis. So what this pandemic has taught us here at TC Energy, and I think as a business community, is that we need to come together to overcome these kinds of challenges. It's not us versus them. It's not public health versus the economy. It's and, not or. We need that conversation. We need to be aligned, and it only works if we can work in kind of lockstep. So like the public health system, whether it be policy or the delivery of healthcare, we think businesses, they have and they'll continue to be innovative and nimble because we have to. And we have to find a way to advance without compromising safety, as we look forward after this pandemic. In some ways, businesses need to be part, the important part of this conversation. They tend to be the conveners of people. Whether you have a big office building that you get a lot of people into every day downtown here, or whether you are a restaurant and you invite people in to dine with you every night. We tend to be the conveners of people. And I think that there's a role for business to play in this conversation around how we go forward. So in our company at TC Energy, we've tried to lead by example. We've learned a lot of lessons along the way, and we've been guided by the public health recommendations and protocols. We've stayed true to our values around safety, responsibility, integrity, and collaboration. And it's time now for us as a company, as we're getting to this very good place. But I think, and as a community, to lift our heads. We've strengthened our crisis plan through this. My belief is that we need to continue to collaborate as a community as we navigate our way through and hopefully out of this. We need to be open, I think, to having real conversations about what worked and what didn't. We have, all of us, built a bit of a muscle here around how to respond to crises like these. We can't let that muscle deteriorate. We have to make it stronger. And we do that through honest dialogue, through reflection, and a commitment to learning and to action what we learn. So listen, Fiona, thanks for having me here today. I'm really kind of pleased to be involved in this dialogue, and I hope it's the first of many more productive discussions to come.
Thank you so much, Tracy. Our next speaker is Dr. Toomb. He is a professor in economics here at the University of Calgary and a fellow at the School of Public Policy. For Dr. Toomb, I had to switch over to Twitter to stalk him. So there, I learned that he has over 30,000 followers and near daily tweets throughout the pandemic. Currently, the focus of those tweets are about how Alberta is doing in comparison to other international places on our vaccination rates. So speaking to the source of constant, reliable, rapid information that he's provided throughout COVID, again, how he's informing and shaping our thinking throughout this. Thank you for joining us, and over to you, Dr. Toomb.
Well, thank you, Fiona. It's great to be here, and thank you to everyone for spending an hour with us today. I think part of the theme of this panel is to invite us all to reflect on some of the hard lessons that we've learned over the past year and a half and how to use those to safely and successfully transition to a post-COVID world. And of course, there are many lessons, and I just want to focus on a couple here in my brief remarks on building more resiliency and flexibility into our businesses, our people, and our governments. So when I talk about resilience on the part of business, I think this is potentially meaning that we need to change how we produce what we produce in lots of different areas. This means increasing the use of technology to connect with customers and with employees. Maybe it means more flexible working relationships. But at a macro level, and of particular importance for Canada, is how COVID reminds us of the benefits and the costs of international trade. So much of our income in Canada and our standard of living depends on open access to global markets, both exports and imports. Nearly half of global trade crosses more than one border. And for Canada, roughly 1/5 of every dollar that we export actually embeds within it value added that was produced in yet some other country. And almost as much of what we export to a country abroad is exported to yet a third country to be used either to produce another good or for consumption there. So these long supply chains really carry with them significant benefits, higher productivity, for example, but also exposes us to risks. And we saw that through 2020. Disruptions occurring in one part of the supply chain can cascade and disrupt producers elsewhere along the chain. Ramping up PPE was a challenge early in 2020. We saw that. And Canada depends on international trade for access to those products. Mask imports, for example, jumped more than 700% last year relative to the year prior. Auto manufacturers stopping entire model runs now because of chip shortages is another example. And Tracy spoke to some of the challenges at TC Energy. But those challenges don't mean we should pull away or pull back from international trade, as some suggest. COVID has demonstrated the real power of international trade and global cooperation to overcome these public health crises. Vaccines are a great example. You have stabilizers produced largely in France, combining with preservatives in Germany and adjuvants in Mexico. You have the little stopper things on top of the vials being produced in Poland, combined with needles produced in Ireland, and so on down the list. So vaccines are themselves a product of global cooperation. On the research side, Canada is also in the top 5 countries in terms of those that collaborate on scientific research related to COVID-19. So we can deepen our connections, but prepare better for future disruptions, larger inventories, more diversified supplier relationships, and so on. So now briefly turning to individuals and governments. For individuals, resilience and flexibility means in part enhancing our mobility and our flexibility in response to shocks, improving our ability to shift occupations, maybe shift sectors, shift employers, maybe even shift across regions. And education is something that we're seeing as central to that. Employment rates of those with lower levels of education are significantly below where they were pre-pandemic today. But if you look at those with a bachelor's degree or higher, employment rates among that group are actually above where they were prior to COVID. And so governments doubling down on support and spaces for retraining opportunities for post-secondary institutions, I think is going to play a central role for us having a prosperous future going forward. And then finally, governments. And Alberta's government in particular, I think we approach finances in a way that doesn't do a good job mitigating risks. I think we need to think about budgeting and funding public services in a way here that doesn't connect ourselves to the price of oil, because during big disruptions like COVID, oil prices fall, and that exacerbates our fiscal challenges at a time when we already had enough challenges to deal with. So I think making some tough choices going forward to minimize risk and ensure long-term sustainability, as the value of that was really reinforced through COVID. So with that, I'll conclude and look forward to the conversation. Thank you.
Thank you. And now to introduce our final speaker. Mayor Nenshi is, of course, the Mayor of Calgary, and he's the only one of our speakers who I found a Wikipedia page on. There, I found an incredible list of accomplishments across public works, transportation, social initiatives, taxation, and reconciliation. There, in amongst all of these amazing inspirational accomplishments, the highlighted accomplishment was Mayor Nenshi receiving his second dose of vaccine exactly 1 week ago. You are complete, Mayor Nenshi, as they say. Thank you so much for joining us, and over to you.
Thanks so much, Dr. Clement, and thanks to everyone for joining us today and having this great conversation. But I refuse to believe that Trevor Toomb does not have a Wikipedia page. I might refuse to believe that Trevor Toomb hasn't written his own Wikipedia page. But as I tease Trevor, let me just say, Trevor, in particular, you have been a must-read for these last few months. Your skill with communicating complex data has been extraordinary, and I'm very grateful for it, and I've used it a lot. So thank you for that. I won't take long because I really want to get into the dialogue, but I just want to highlight probably a few things that everyone knows already, which is that this pandemic actually occurred at a time where we had 5 simultaneous crises. And I feel like any one of those crises in a normal year would have brought politicians and academics to their knees. And we got 5 of them. So of course we have the public health crisis. We have a mental health and addictions crisis, which was here before, but certainly has been exacerbated in this last year. We're in a deep economic crisis. We're in a global environmental crisis with a climate emergency. And we're coming to terms on something that has been extraordinarily difficult for us as Canadians, which is a real reckoning on what is the meaning of true anti-racism. What does reconciliation mean? What does it mean to go from being a multicultural? I see I'm glitching very badly, so you're seeing my messy bedroom behind me. I'm not really sitting on Scotsman's Hill. I'm just trying to hide my messy bedroom. But that usually doesn't glitch like that. But anyway, we have to really come to terms with us going from a place that is rightly proud of being multicultural and diverse and pluralistic to understanding that it's not enough to strive to be not racist. We actually have to move to true anti-racism. And we're not sure what that means or where it goes. And I think I just want to highlight very quickly something that will surprise no one who would sign up for a seminar like this, but the fact that the crises that we've gone through, all 5 of them, have really, really underlined the fundamental inequities in our society, or some of them anyway. So I often say that probably none of us thought before last April about the fact that there's a very large group of people in Calgary who get up very early in the morning every day, get on the bus, and go to their work at a long-term care center, where they wake up our parents and grandparents, change their diapers, get them ready for breakfast, and they work hard through the lunch shift. But because the private operator of that long-term care center doesn't want to pay benefits, they don't get 40 hours a week. So after the lunch shift, they get on another bus, go across town to another long-term care center and do the same thing in the evenings for the dinner shift, and then get home maybe in time to see their kids before they go to bed. And these workers are almost all women. They're almost all racialized women. And they are among the lowest paid people in our society. And when the pandemic hit, well, first we blamed them for working at 2 different places, which is dangerous, and they're spreading the virus. And yet at the same time, we realized that they were essential workers. And our whole concept of what is an essential worker has really shifted. I used to be a management consultant. Nobody really needed a management consultant during this pandemic. I like to think they did, because we were trying to figure out how to distribute vaccines, but nobody really needed one. Nobody needed a securities lawyer, and nobody needed an economics professor who's not Trevor Toomb. So ultimately, the people that we need are often the people whose work is not valued in our community. And I hope certainly not monetarily. And I hope that part of our post-pandemic world, I refuse to say we're returning to normal, because I don't want to return to normal. I actually want to build something stronger and better with all the lessons we've learned from this pandemic. So I'll leave that there, and looking forward to the conversation.
Great, thank you so much. And I'll invite all of our speakers to turn their cameras back on now, if you're comfortable with that. It's time for our conversation. Audience members, just as a reminder, please enter your questions into the Q&A chat box on Zoom at the bottom, or if you're on Facebook, you can also send them in that way and they will get to us as the panel. We're going to do our best to cover as many as we can. While we're thinking about that and you get your juices flowing, I'll take the opportunity to ask a question. I heard all of you, through your different perspectives, comment on new partnerships, new collaborations, new ways of thinking. And I wonder how we actually take this forward. So, you all commented on how important that was and how the crisis really pushed you to do those things. How do we keep that going, and how do we keep that way of thinking in our society when it is quite easy just to kind of rubber band back into the ways we're used to doing things and what's comfortable to us as siloed industries? Maybe Tracy, I'll invite you to comment first and then welcome others to jump in.
Oh, let me unmute myself. Thank you. Thanks for the question, Fiona. I think it's an important one because you're right. This all will be lost, all of what we've learned, if we don't kind of really focus on making sure that we live from it in a way that takes us further into the future. And I want to kind of reference Pam's question as well in the Q&A. So I think at the first level, we can't wait for somebody at the center to figure out kind of what the path forward is, right? So what we've learned is that every community, whether it's an Indigenous community or it's a Northern community, but every community is different and has unique needs. So there's no one solution that is going to fix for all. So for businesses, for companies, I think even for healthcare, it's a matter of approaching communities on that unique basis. And there's ways for us to partner where we can be helpful. And at the base level, to Pam's question, at the base level, it's making sure that you do no harm, that you keep everyone safe. Then there's a level up that you start to look at ways that you can help. And whether it's help providing facilities, whether it's financial help, whether it's help on certain structures. We've provided, security facilities in Indigenous communities and the like. And then I think at the next level, there's the question, is why I use the example of what we're doing with Northern Health, is there a role for business to play in partnership with healthcare on things like administering vaccines? Can we bring capacity to bear that will speed up and reach some of those less advantaged communities much faster and earlier, because we're already there and we have facilities, we have a presence in the community. So I think we have to start thinking in a very nimble fashion in ways that are unique to each type of community as we go forward, and start stepping into this now, as opposed to stepping back and trying to recreate it the next time we come across something that has this kind of need, an urgent need.
Anybody else want to weigh in and build on that?
Well, maybe just very briefly from a government perspective, being the mayor is interesting because in Alberta, unlike in other provinces, and sometimes people are surprised when I say this, the municipalities have no public health role. In other provinces, you have a medical officer of health who works for the city, but in Alberta, it all lives in Alberta Health Services. And so for me, it's been interesting because I have no official authority whatsoever on managing the pandemic with the exception of the mask bylaw. But at the same time, people look to me and to Chief Henry at Calgary Emergency Management for leadership in navigating through the crisis. And so I've had to work in a very interesting way with the provincial government at the political and the bureaucratic levels in order to make sure that they understand what's right for Calgary. Because they have, Dr. Hinshaw has to make decisions for the entire province. And they're not always the right decisions for Northeast Calgary, for example. And so that has actually been both extremely gratifying and extremely challenging. So there have been points where I talk to the Premier every day and we are, hand in glove moving forward on things. And there are points where I see their daily press conferences and say, what are you doing? There's probably more of those lately than the other. But ultimately, getting that right, even between orders of government, let alone between all of our partners in the community, has been challenging. But one of the best things we did, very briefly, when we started this work is we set up these series of task forces at the city. One of them was an internal one that really looked at how we were running our organization. Remember, we got 15,000 employees. So we had to keep our employees safe. We had to figure out how to manage our organization. One of them was about long-term resiliency and what happens. So even at the very beginning, we were already talking about what happens afterwards. One of them was on strictly financial aspects of how we were managing things like our taxes, our cash flows, and so on. And one of them was a business support task force. And all of them involved other stakeholders getting in there. And the most interesting example is the business support task force, where we had restaurant owners and small business people and large business representatives all in a room. And they would say, you know what, something that would really help us is if we could have bigger patios, since people don't want to eat indoors. And we were able to just make a move and really, really impact people's bottom lines. And I like to think that we're always plugged in that way. But this crisis helped us a lot, particularly because Calgary Emergency Management, and everyone should know, you should be very proud of Calgary Emergency Management. It's a model not just for the country, but for the world. My predecessor set that up, they invested in it, and it really is a remarkable thing. And one of the reasons it works so well is because they have one-touch access to every agency, every business, every landowner in the city, and they can bring people together when we're in an emergency. And that has just been extraordinarily useful. And I hope we can keep doing that as we're dealing with all the silent emergencies in our world: mental health, racism, economic development, and so on.
Thank you. I'm going to take questions.
I just wanted to jump in for a second on the question of mental health, and also connecting to a question in the Q&A about short-term memory and already forgetting aspects of COVID-19, because I think these are related issues. And we need to think about what's happening to people as they go forward dealing with COVID-19 and the mental health pressures it's put on people, beginning with the pressures of grieving parents who, you couldn't see when they were dying, or, the pressures that kids have faced and parents through schooling. I mean, one of the big lessons of the 1918 to 20 flu pandemic was a non-lesson, was the price to be paid for forgetting. And I think it's important to not want to rush past COVID. And I completely understand the desire to rush past for all of us. But there's a double burden that happens, I think, to people that has mental health consequences when their experience is sort of suppressed in public memory. And that may increase what people are facing going forward. So I think it's really, as when we think about how business communities and others might work together, there's been so much movement toward greater recognition of mental health, but COVID raises all of these new issues in mental health. And memory and grieving and mourning are a really significant part of that, that I think we could just, even if we're mindful of it, it's a place to start. I hope to do some work going forward on the impact on children and youth, especially of familial challenges to post COVID-19. But it's something that we don't really know enough about. Where are we headed with that? Where are we headed with the way people deal with their changed circumstances as a result of COVID and the unprocessed grief and mourning? Thanks.
Thank you for that important reminder, Esselt. One of the other questions in the chat box is asking you each to reflect on your sort of aha moment. So, the moment during the pandemic where, your shifting was really changed, or perhaps you really realized you needed to do something different or do something. So maybe, Trevor, we'll start with you on sort of where your aha moment was about, when you realized you needed to do something, I guess.
Well, that's a great question. I think the aha moment that during the pandemic really led me to change my thinking in a really big way was, yes, fairly early on, governments moved rapidly and significantly in so many areas, not just in terms of public health responses, but in terms of the income support programs for individuals and businesses. And prior to that moment, I'm not sure I would have said it was possible for such large-scale programs to be rolled out. Put aside questions of the political will or the policy choice. I literally would not have thought it would have been physically possible to process the number of applications that they did or the payments that were made. And so seeing that governments can achieve big things in a pretty short amount of time was, I think, a remarkable realization on my part. Now, of course, that does come with risks, for sure. When you make big policy changes quickly, you can overlook some details. And we did see governments pretty rapidly reform and iterate some of the eligibility criteria, for example. But it really does speak to our ability to achieve large-scale initiatives, and we shouldn't shy away from them in the way that I would have previously given the scale. So remembering that governments can accomplish great things is I think important going forward, because there are a lot of significant challenges to come, and governments are going to be a key part of that. I guess related and building on something that Mayor Nenshi noted, that Canada is a very decentralized country. We don't have kind of levels of government. We have orders of government that have different responsibilities in different areas, and often they overlap. And the need for coordination, in a productive and regular way is very important. And we could do that, I think, a lot better. So some lessons learned just in terms of how governments can work together successfully. It's not always just a battle between provinces and the feds or between municipalities and the province. We can and should expect all orders of government to work together productively going forward.
I'd be happy to go next, Fiona, if that works.
Yeah, please.
Yeah, I agree what Trevor spoke about. Amazing what's possible, right? You only sometimes find that when you're challenged to respond. I would say that on a bit of a similar basis, one of my aha moments, so often when you have a crisis and a crisis plan, whether it be municipal or whether it be corporate, you know, it's led from the center. There's a core central plan that's dispatched, and you have rules and processes and protocols. And that's kind of how we started. And I think it's a lot of how we all started. And what we discovered pretty quickly, and my aha moment was in a conversation with one of our leaders in the field in operations, where all of the protocols that we laid out, he'd done something completely differently. And it was better because it was something that was unique to the situation that he had at hand. And so, you know, I think what we have to do is learn to kind of launch and mobilize, not just from the center, but on all of the limbs, right? Because those in the moment, in the spot, whether it's a community or whether it's a facility or whether it's in a hospital, they have to know what we're up against, but they have to have the mandate to do the right thing. And that's when we start to really get some traction. Every situation is unique, and we have to be able to be nimble enough to respond. Feeding back so we're all learning, but nimble up. So when when this happened, we kind of started to give a lot more license to each of the folks who were dealing with it. Was our community relations, our Indigenous affairs, or our field operations, or our construction, a lot more latitude to how they responded to the issue in the moment. And that's when we really started to get some traction. So that's a big learning, aha moment, but also a big learning as we think about what comes next from all of this and how we do better.
Thank you, Tracy. The next question I think should be, I welcome all four of your reflections on this. This one is from Gary, and it's about providing good information and science and evidence and enabling civil discourse on important topics, recognizing that, you know, in a situation like COVID or the next pandemic, information will be evolving fast, and there is a level of risk and uncertainty in that. How could we think about evidence moving forward? What should we be expecting on that front? And how could we counterbalance some of the discourse that is perhaps unproductive, that is especially prominent on social media?
Maybe I'll jump in to start. And this response might seem somewhat self-serving, but I think the University of Calgary is going to play a central role, and institutions like it a central role, in helping improve dialogue and conversations going forward. I think through the pandemic, we saw the university respond in a big way through ensuring that experts in public health and other areas were there, available, providing their expertise and mobilizing their knowledge to the broader community. And it is one of the two central pillars of what guides the University of Calgary's kind of strategic vision. Obviously, an exceptional student experience on the one hand, but also impact on the other through our research, but also through disseminating that research to the community. So events like this and others facilitated by the university and related institutions, I think will be key.
Yeah. Mayor Nenshi, I wonder if you could comment on evidence and what we should expect on that front moving forward. Where does it fit?
Yeah, I think there's two really interesting things that are raised in this conversation, in this question from Gary. The first is this question of evidence and leading with science. That's been important to me, and I'll give a shout out to you, Calgary, as well. One of the very first calls I made, March the 8th, I think, of 2020, was to Dr. Galley, the VP Research, saying, I'm going to need some help. And he put together a group of what I call my research assistants, who are in fact, you know, incredibly skilled scientists, economists, and others who I just ask questions to. And the most recent question has been, should we be focused on second dose numbers if we should remove our face mask bylaw rather than first dose, which the province is focused on? And they go away and they do a ton of work on this. And so I've tried to be very evidence driven in a time where that's not very perhaps popular in politics, but I've always tried to be that way. And this has been very important. But, you know, look, math is hard. I mean, bluntly. And even heard the this week say, oh, well, you know, the Delta variant is doubling very quickly, but the numbers are small, so I'm not that worried. And I think probably everyone who was listening to that went, what? If it's doubling very quickly, the numbers won't be small very long. And so really helping people understand things like, what does exponential growth mean? What does it mean when ICUs have 300 people with COVID in them? That doesn't sound like a very big number in a province of 4 million people. But of course, it's a gigantic number because the ICUs are always normally full. They always operate at 100% capacity. So you got 300 new people in there. How are you going to manage that? And it's hard for people to get that. And again, you know, people on this panel, Dr. Jones, Dr. Toomb, have done really good work on helping people understand that. You know, I always joke that Trevor's great skill in life is that he's very good at making graphs. But a lot of those graphs have been incredibly useful for people to understand trajectory, where things are going, and so on. So that's been critical. Now, the second half of the question is, what about the non-evidence-based stuff? And, you know, we had the bad luck of this pandemic happening at a point in public discourse, which is extremely unpleasant. And we've had people attempting to hijack the narrative. And the challenge that you have when this happens is that, you know, the nerdy people with letters in front or behind their names who are saying, well, actually, let me show you the science, sometimes can be completely drowned out. And that's why, you know, for someone like me who has a microphone, it's been important for me to use the microphone, even though I'm a bit out of my own lane in terms of this public health, because I can help people understand, how does this matter to you? What do you need to do now? But what's really interesting is we're actually at, I think, Trevor, is this correct? We are actually at the highest first dose percentages in the world, not just in Canada, but in Alberta and in Calgary. You know, East Calgary, where we have our lowest numbers, has among the highest numbers in the world. So that means that most people are on board. But if you look at any article on Facebook or on Twitter, every single comment is, this is a hoax, this is terrible. And this is a tiny minority of people. And the other thing that I really need to highlight for everybody, and no surprise to anyone, and I know, Dr. Jones, you've been thinking a lot about things like this too, in terms of the inequities, but the thing I really need to highlight for people is that a lot of this has been taken over by really awful stuff and the impact that has on people's mental health and so on. So I've been saying, look, you might be an anti-mask person and you might have really good reasons to be an anti-mask person. But when you show up at a rally that is being led by people with tiki torches and known racists and people with hate symbols, guess what? You're complicit in that. And your message is gone because that's all people see. And that has been very challenging. And I just continue to try and stand for evidence and kindness and compassion. And that's all we can do, I think.
Thank you. Eshel, just in the last 3 minutes here, over to you for the last word on this, I think.
I just wanted to echo the kindness and compassion part, because I guess I'm an expert, but an expert in science is incredibly important. But a lot of what we encounter in these situations is people's lived experience and their emotional realities, and that needs to be listened to and honored and remembered. And that is really how we reach people, not just with a bunch of evidence, but also finding a way to communicate that we kind of get where they're coming from and get where they're at. And sometimes that means engaging with people that we find, difficult or unpleasant. But I would echo what Mayor Nenshi said about a very small minority being very loud, whereas the majority experience is actually, maybe the one that is important, including those from racialized and marginalized communities who are struggling to get vaccinated in between their shifts at work and so on. That we need to keep honoring and listening to those experiences.
Thank you, and what a perfect note to end on. Thank you so much for the wonderful discussion. And for those in the audience whose questions I didn't get to, I apologize. I know we could talk all afternoon, so Thank you for putting the questions in there, and I am sorry we didn't get to them all. With that, I'd like to turn this back over to Tom.
Thank you, Dr. Clement, for guiding us through an important conversation. Thank you, Dr. Jones, Toomb, Robinson, and Mayor Nenshi for showing us how to jointly think about health and the economy as we work to leave the COVID-19 pandemic behind. You know, I heard lessons that we can implement immediately and lessons to help us think about how we can build a more resilient society to better withstand future public health emergencies. Our discussion has also reminded me of the importance of respectful, thoughtful, and robust dialogue that challenges us to find better ways of helping our communities. And so I encourage everyone who participated today to continue to engage and promote such constructive conversations. I'm confident that we'll be collectively better for it. And then finally, as we head towards summer, please stay well and make time to recharge from what continues to be an ultra marathon for many of us. Thank you.